What is a COVID-19 vaccine? The COVID-19 vaccine stimulates the immune system so that in the instance of exposure to severe acute respiratory syndrome coronavirus 2, our body would be able to react against the COVID-19 infection. Various platforms such as RNA genetic sequencing, viral vectors, deactivating virus, and protein subunits have been used to develop safe and effective coronavirus vaccines. It gives you the best protection against COVID-19. With what hopes people take vaccine? There is no easy way out of this pandemic, and unfortunately, it is far from over. Yet, as we move into our second year of living with COVID-19, additional tools for fighting the virus bring hope. We are now optimistic about the development of new, safe, and effective COVID-19 vaccines. People take the vaccine in the hope that they will be able to walk around mask-free, socialize in crowded areas, and go back home to their loved ones who are in different states. Being vaccinated will stop you from getting very sick, but it may not prevent you from passing the virus on to others. While these new vaccines are very promising, no vaccine is 100% effective. So, even when once vaccines are rolled out, we must maintain adherence to all the other measures that we know work to stop transmission of COVID-19.
Malaysian government has implemented the COVID-19 vaccination program in Malaysia, which is a vaccination campaign that is currently as an approach and hope in curbing the spread of COVID-19 and ending the COVID-19 pandemic in Malaysia by successfully achieving the herd immunity among citizens and non-citizens residing in Malaysia. The COVID-19 vaccine supply access guarantee special committee was also established to ensure the procurement of COVID-19 vaccine supply for the country can be carried out in an orderly manner. The immunization program is currently being implemented in phases from 25th February 2021 to February 2022. And Malaysia's Prime Minister Muhyiddin Yassin became the first individual in Malaysia to receive the COVID-19 vaccine when it was broadcast live nationwide to inspire Malaysian citizens to be vaccinated with the hope to reduce the daily positive cases arise as well as to reduce deaths too.
According to New Straits Times, 40 healthcare workers in Malaysia were infected after being fully vaccinated with COVID-19 vaccination, but it was reported as less severe symptoms. 9 cases were infected more than 2 weeks after the second dose, and 31 cases were infected less than 2 weeks after receiving their second dose of the vaccine. According to the Reuters COVID-19 Global Tracker, COVID-19 infections are increasing in Malaysia with 3,048 new infections reported on average each day. That is 64% of the peak, the highest daily average reported on February 4th. There have been 411,594 infections and 1,521 coronavirus-related deaths reported in the country since the pandemic began. According to us, before COVID-19 vaccination were brought to Malaysia, the COVID-19 cases were marginally higher, though still in the 4 digits, but after COVID-19 vaccination, there are no differences in the cases of COVID-19. In reality, it is still gradually increasing day by day.
Why people are afraid of COVID vaccine? The fact that vaccines normally take up to 10 years to produce has had such an effect that some people don't trust the COVID vaccine because it was invented so quickly, barely a year after the pandemic began. Some people think the risk outweighs the benefits and aren't serious or dangerous. Besides that, many people believe that pharmaceutical companies can't be trusted. They think that pharmaceutical companies only want to sell their products regardless of the impact on the people who use them. When people distrust science, they are less likely to vaccinate. They are also less likely to trust the doctors who recommend vaccines. This is why the WHO says people who should not drop their guard and stop taking precautions against the coronavirus because the vaccine may mark the beginning of the end of the pandemic, but it is not going to bring it to an end in the immediate future.
Mr. Khairi Jamaluddin, Minister of Science, Technology and Innovation, said 80% of Malaysians will have received their COVID-19 vaccination by this year's end. A total of 2,990,577 individuals have registered themselves in the MySejahtera application to receive the COVID-19 vaccine. Selangor recorded the highest number of registered individuals, followed by Johor, Kuala Lumpur and Sarawak. Malaysia has administered at least 1,421,664 doses of COVID vaccines so far. You may have some side effects which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in a few days. Some people have no side effects. The common side effects on the arm after getting a vaccine are pain, redness, and swelling. Throughout the rest of the body, you might feel tiredness, headache, muscle pain, chills, and fever.
Unusual temporary symptoms such as dizziness, vision change, numbness, or seizure-like movements may happen after vaccine injections. Sitting or lying down may relieve these symptoms. A very serious allergic reaction, anaphylaxis, such as rash, itching, swelling, trouble breathing, may occur after being vaccinated. Vaccine indicates a rare risk of serious adverse event called thrombosis with thrombocytopenia syndrome. It is very crucial to get medical help immediately if any of these symptoms are noticed. However, it is unknown at this time if this COVID-19 vaccine causes serious side effects. Rarely, some death cases reported after being vaccinated is related to the vaccine side effect, but it is not proven officially by any authority yet, and this is still under observation since some severe side effects may be the reason behind this. All viruses, including SARS-CoV-2, the virus that causes COVID-19, evolve over time. When a virus replicates or makes copies of itself, it sometimes changes a little bit, which is normal for a virus, and only vaccines can save this world. Since everybody is in a vulnerable position that might be affected by COVID-19. Thus, the hopes of vaccination to reduce the number of positive cases and deaths outweigh the fear of people on the severe side effects of vaccination, which may appear in one among thousands. People must realize that side effects are normal signs that the body is building protection. Some people experience them and others do not. So COVID-19 vaccination should be galvanized for the betterment of each and every country in the COVID-19 management system.